Hi, I'm Nurse Amy and welcome again to our series of lectures, and this is part 2 of care settings, which I started in the last video. If you're a repeat visitor, thank you. I appreciate your support. And if you're new, this is Nurse Amy channel on YouTube, where we talk about everything CNA and beyond. Please remember to subscribe, like, and share this video. Write to me directly at nurseamyacademy@gmail.com or leave your comments. I really would appreciate hearing from you. So continuing with our care settings, we had started to talk about acute care settings. And I remember in the last video, I had mentioned chronic, and then I juxtaposed it with acute. Just a brief refresher. Chronic means long-lasting, something that is manageable, something, an illness or condition that is just being treated. However, it's probably not going to go away. So it's just been managed, okay? While acute is a difference from the norm. So acute comes on very suddenly and it needs immediate attention. So in acute care setting, and this is where you have your hospitals. Now, for those of you who are quite new in the healthcare settings, you will find that in acute care settings, a lot of times the main intention is to stabilize the patient. So the person comes in with an acute illness or disease or new onset of a condition, health condition, and in the acute setting, like in the hospitals or surgical centers, is to stabilize that person. And once they're stabilized, they're sent back to a different care setting where they can then rehabilitate. So we're going to come to some of these care settings where patients can rehabilitate. So the next care setting, and just so I remind you, if you're not clear about the things I'm talking about, or you need more clarification, again, feel free to write to me at nurseamyacademy@gmail.com or just leave your comments down below and I'll be sure to answer your questions. So the next care setting is skilled care. Now, skilled care setting is the same as acute. And even in long-term care settings, you also have skilled care. What skilled care just means is that they need more invasive or more detailed care. Does that make sense? In chronic settings, which is also in a long-term care setting because you have the chronic. So in a nursing home, just so I can break this down, in a nursing home, you have people with chronic illnesses. Like I said, they're just being managed. Okay, they're manageable, they're stable. Now, for skilled care are things that you will do for residents and or patients to maintain their status quo or to bring them to their status quo. So skilled care will be provided by nurses, by therapists, by doctors, people like that. Unlike the certified nurse and assistant, they provide unskilled. We'll talk about that later. I just don't want to throw you off, the path we're going on now. So let's just talk more about the different care settings, and then we'll go, deeper as we move further along. The other care setting is home health care. Now, home health care pretty much explains itself. It's care provided in the patient's home. And there are different types of care. It could be skilled, it could be unskilled. It doesn't matter. It's just that it's care as opposed to being provided in a hospital setting or in a nursing home or in assisted living, which we're going to talk about after this. It's provided in their home. Okay, and some people prefer that. A lot of people actually prefer that. They would rather have home visits from skilled therapists, nurses, doctors, and unskilled, as in the nursing assistants. The next one will be assisted living. Now, a lot of times they would like to ask you questions comparing assisted living to nursing homes, to long-term care facilities. The major difference here, in the assisted living facility, the residents there do not require 24-hour skilled care. So you need to remember this. That is the major difference. In the assisted living community, they can still do for themselves somewhat. They do not need 24-hour supervision. They can still socialize, they can go out, they can drive their cars, so they can still feed themselves, they can take their medication. Sometimes they need to be reminded, and that's okay. So that's why it's some kind of assistance. So it's not 24-hour skilled care. And then after this, we come to adult day services. And the way you can understand this is compare it to childcare services. Now, I'm very careful here, and you need to be too. Adult day services, just because I'm comparing them to childcare, daycare, doesn't mean that adult day services need to be treated like children, okay? They're adults who are not probably okay to be left alone by themselves at home because they're having some kind of challenges. It could be ambulation, meaning they can move around the way they have been doing in the past, and so they pose a fall risk. They're prone to falling down and there's no one at home to tend to them, or they're starting to forget things. And so it's not easy to trust them with occupational type activities like cooking, like dressing, like having a shower by themselves, and seeing there's no one staying at home with them. So what their children or their caregiver will do is take them to an adult daycare where they can be supervised. They can be chronically ill, but they're not as dependent as the ones in the nursing home. Again, if you need more clarification, put your comments down below or write to me directly at nurseamyacademy@gmail.com. The next care setting will be subacute care. I would like to explain this as subacute care is another way of saying rehabilitative care. It's performed in any kind of care settings. It could be in your home, it could be in the nursing home, it could also be in the hospital. It's just a type of care that is not an emergency, but you're not stable enough to be let go. Does that make sense? It's not an emergency, so you're not necessarily out of sync. However, you're not stable enough or back to your baseline to be released just yet. So that's what subacute is, like a step down from emergency. The other type of care is outpatient care. And basically the difference with outpatient care and inpatient care is that for outpatient care, your treatment is less than 24 hours. So you go in there, get your surgery, get your treatment, get whatever kind of visitation you're in for, but it's usually less than 24 hours. So these are things you need to be aware of. The other type of care is rehabilitation care. And rehabilitation is a word that is used to indicate that a person or an individual is being treated. The skilled caregiver is trying to do to this patient is to return them to status quo or to the highest functioning capability that they can return to after an illness or an injury. So that's what it is, like someone who's had like a fracture or even a surgery, knee replacement, stuff like that. They need to be taught again or managed to a place where they can function at their highest potential before they had that surgery. So hopefully you're following along. The next care is hospice care. Now, hospice care, this is palliative care and is not curative. So palliative is just saying comfort care. They've been termed terminal. So that means at the end of hospice, they've been determined by a doctor that they're going to die. And usually it's about 6 months. They also have to agree to be in hospice care that they're not necessarily going to get better, but they're just going to have some kind of comfort care, emotionally, physically, things just to treat their symptoms and make them comfortable. So that's hospice care. So that's all the different care settings. One thing you need to understand about care settings, especially in the nursing home, the long-term care facilities, we need to understand that this is their home. So paramount in our care is respect, and to appreciate and acknowledge the fact that this is their home. So a lot of time people forget that. We see it as a place of work. So we go in there just, with disregard to their space, to their dignity, to their privacy. You need to understand that when you step into a long-term care facility, wherever it is practiced, that this is their home. So you are there because they've given you permission to be there. So that's very important. And you're going to see that always come up in a lot of the questions you'll get in your exam. It's all about privacy, respect, dignity, and rights. I always tell people this: if you're not sure what rights the patients have, think about yourself. What rights do you have? If you have those rights, they have it too. They're not in prison. This is their home. Remember to press that subscribe button, subscribe to my channel. I need your support and encouragement so I can keep churning out these videos. I believe it's helpful. I have been getting some emails already. Thank you. Soon I will be doing a Q&A and I'll be answering your questions. But feel free to leave comments below. I will be telling you as I go along what it's going, what things I'm up to, and more ways to reach me. And take care of yourself.